why on a stool? Why not just have the person, okay, simply turn their head? Okay, well, for several reasons. What we want to do, we want to engage the lower cervical spine. So we want to engage C7 and T1. Okay, so the only way to engage C7 and T1 is to have the person rotate underneath their immobilized head. Okay, I smell that food. Oh. Okay, if you have the patient just turn their head, you're not activating the lower part of the cervical spine, and you are not activating T1. So that's why you put them in the chair so they can rotate themselves. Again, you're only going to go through the range of motion that the person can do. You're not going to let them go where it hurts or anything like that. Okay? Now, we're not looking for neurovascular. What are we looking for? Myogenic. Okay? These are caused by trigger points, either in your SCM, in your levator, or in your trapezius. These are the big muscles of your neck. Trigger points are bundles of lactic acid, which is the byproduct of muscle use. So individuals can develop trigger points because the way they carried a book bag, the way they carried a baby, working on a computer, on a mouse, any of these kind of things. Okay? So we're looking at neuromuscular activation, again, in the trapezius, sternocleidomastoid, or the levator. Those are the three muscles of the neck that are most likely to develop trigger points. What is the treatment for them? We're going to have to put them down. Okay? What is the treatment? It's neuromuscular therapy with myofascial release. It's massage therapy, basically, but a little bit more involved with heat, ultrasound, these kind of things. The therapist is going to identify, once we find that this person is positive for this, the therapist will identify the trigger point and then work it and try to break up that lactic acid. They'll either do it with their hands, they'll do it with heat, or they'll use like a little device and basically dig into that knot. Okay? Then the patient is asked to drink lots of water to try to help flush that lactic acid pocket out. Now, the other thing that the cervical dizziness test can look for is, in addition to the neuromuscular, it can look at some spinal or bone impingement on nerve. This will create what is referred to as a radiculopathy. Okay? A radiculopathy is a weakness or numbness into the distal portion of your extremities. Okay? It's a nerve impingement. So it's bone on nerve. So you're not going to get, you could say it's, well, yes, it's a neurologic finding because it's basically affecting the electricity, but it's not going to be neurovascular. Okay? So what we will ask the patient is, we're looking for different symptoms. So if it's if it's myogenic, what we're going to be asking for is, do you have any pain? Okay? Do you have any burning? Do you have tinnitus? Okay? It's not uncommon for this to actually cause tinnitus as well. Do you have a feeling of flush coming up on the side of your face? To ask about the radiculopathy, we're going to ask the patient if their arm feels numb or tingly. Okay? Do they have numbness in their fingers? Okay? So, let me just ask you to take your glasses off for a second because I'm going to grab your head. So, what I'm going to do is I'm going to hold the patient's head and immobilize it. I'm going to tell them I'm going to immobilize your head. What I'm going to ask you to do is, using the wheels, use your feet, and I want you to turn yourself around. Okay? So I'm going to immobilize his head and ask him to turn to the right. Okay, just stay right there. Don't go any further than that. Okay. Now, as we have you in this position, do you feel any burning or pain in your neck or shoulders?
No.
Okay, do you feel a feeling of heat or flush up the side of your face?
No.
Okay, do you have any ringing in your ears, buzzing, humming?
No.
Okay, do Do you have any numbness or tingling down into your right arm or fingertips?
No.
Would you like to? Okay, now come on back and relax, okay? Now we would simply do it what? To the other side. Now, do you want me to teach you a little advanced? This is advanced, so you may want to practice this a little bit. I'm going to show you an advanced. This is the first time I think I've taught it to this. Usually I don't teach you the advanced things, but maybe it'll make you talk. Okay, so let's say the patient in that position with cervical dizziness has a complaint of, yes, I have this feeling of flush, I have a feeling of maybe of some nausea, I have ringing in my ears. Yeah, this is that feeling that I've got. All right. Well, now what I want to find out is it due to neuromuscular, or could there be some impingement of bone on the nerves? So what I'm going to do is I'm going to let him put himself into self-traction. In other words, I want to elongate his cervical spine. So the way I'm going to do that, I could just grab his head and pull it up, but it could come off. So that's not good, okay? So what I'm going to do is I'm going to have the patient do what is called self-traction. I am going to hold on to their head, and I'm going to ask them to take a very big, deep breath. That will bring their shoulders, their clavicle, their rib cage up. It will bring their head up. I'm going to hold their head in that position. I'm then going to ask them to take a deep, cleansing exhale that will drop the shoulders. That will elongate the cervical spine because I got the head way up here. Not way up, but higher than it was. I'm then going to ask the patient to rotate themselves again. And I'm going to see if the symptoms that they had previously extinguished. If the symptoms extinguish, then it may be more of a problem in the cervical spine than neuromuscular. Does that make sense? Okay. If you were a PT, this is part of the manual certification process. This is how you would test. So what I'm teaching you is a acceptable, standardized PT assessment tool. Okay? So what I'm going to ask you to do is take a nice big deep breath. Big deep breath. Good. Let it out. Good. And now rotate yourself again to the right. I'm holding you pretty tight, aren't I? Okay, most people say it feels good. Okay, you can stop. Then we would ask about the symptoms. And now come on back. And relax. I'm going to let your head back down. Okay? That wasn't uncomfortable.
No.
But in fact, some people go, oh my God, that feels really good. It feels like because you're elongating that cervical spine. Now, what a physical therapist would do as part of traction is they would actually have the patient laying down and do those kind of things to elongate the cervical spine and then work with the range of motion, those kind of things. Now, that's an advanced aspect to it. And that may be, if you're not comfortable doing that, because it takes a while to get, I don't want to spend too much time on that because we've got our repositioning to do. But I just want you to know that's a second level. For your level, I think it's fine just immobilize the head and have them do the turn. But recognize that the second level of that, if you wish to practice it and get good at it, you would have to do that. Okay? It's called self-traction. Okay? All right, so start your engines.